Welcome back. So we talked about the origins of TCVM and the different branches of TCVM being acupuncture, herbal therapy, tuina, and food therapy. And so I'm going to start out with acupuncture because that is probably the most commonly found when you're looking for a TCVM practitioner. It's much easier to find a practitioner that does acupuncture than any of the other branches. That's partly because in order to learn the other branches, you also have to know the basics of Chinese medicine, which is usually taught through an acupuncture course. So, what is the definition of acupuncture? This is from Johns Hopkins website, so human website. They're defining it as the practice of penetrating the skin with thin, solid, metallic needles, which are then activated through gentle and specific movements of the practitioner's hands or with electrical stimulation. Traditional Chinese medicine practitioners believe the human body has more than 2,000 acupuncture points connected by what are pathways that are called meridians. And so there are multiple meridians throughout the body. We have 12 paired meridians, but then we also have single meridians. For instance, the governing vessel starts at the tip of the nose. Maybe it starts under the tail and comes up to the tip of the nose. And then we have the conception vessel, which goes down the midline on the bottom part of the animal. So acupuncture points in animals, particularly in more modern times, have been transposed from human acupuncture points that we know about. And when we do acupuncture on a human, we can ask them, what are you feeling? Where are you feeling it? Because many times you'll stimulate an acupuncture point somewhere, say on the face, and you'll feel it somewhere else in the body. And that's because of the meridians. When you stimulate a point on a meridian, that entire meridian is going to be affected. And there's a really cool phenomenon that can happen, and I've only seen it happen once or twice, I think once in a dog and a couple times in horses, where I would put a needle into an acupuncture point on a meridian, and then they would get what looked like a hive on every acupuncture point along that meridian. They would pop up. Really cool. You don't see it very often, but when it does happen, you know that you have absolutely been dead on with that acupuncture point and you affected that entire meridian. So again, that's more evidence for the body being treated as a whole. You're not just treating one specific spot. So for instance, bladder 23, it is alongside the lumbar vertebrae between the lumbar 2 and 3. And bladder 23 is on the bladder meridian, so it's going to affect the kidneys and the bladder, but it's also a master point or the back shoe point for the whole hind end. So it's not affecting just the kidneys or just the bladder or just the lumbar areas in that muscle. It is having an effect on a big part of the body. Okay. So disruption we talked about this yesterday, disruption or imbalance in the energy flow in an area. For instance, if you have surgery and you have a scar, or you have a scar from trauma, or you have a bruise, you have a swelling, you have a lump, that disrupts the energy flow. And so anything surrounding that area where the meridian cannot get across, the energy flow cannot get across that area, that's a disruption in the energy flow. And so it's going to have a much bigger effect than just where the little scar is. So when we apply acupuncture to certain points on the body, we are improving the flow of qi, therefore rebalancing and improving health. And we do have many, many human studies as well as veterinary studies showing that acupuncture is really effective, and we are getting more and more of those studies all the time. So it's done using very, very tiny needles. On horses, we use bigger needles. And that is something that is more modern, that we now use sterilized, single-use, very fine, sharp needles. In ancient times, they used sticks and stones and other sharp objects that were used to stimulate the acupuncture points. Interestingly, when I went to China in, I believe it was 2008 to study acupuncture, we went to a Chinese hospital where they only use traditional Chinese medicine to treat their patients. It's interesting there you can choose, I want to go to a Western medicine hospital or I want to go to a traditional Chinese medicine hospital. And frankly, the needles that they were using multiple times. And they were huge. They weren't the little things that we think about. And I'll never forget one of the people in our group, we had 50 veterinarians in our group. One of the people, she had lower back pain or something, but they inserted a needle on her forehead and it went under the skin and came out the tip of her nose. It was very long. I frankly thought I was going to faint just watching it happen to her. I could not imagine being her. She did say afterwards, though, that she felt much better. So, eek. But here in the US, the FDA regulates acupuncture needles just as it does any other medical device under good manufacturing process practices and single-use standards of sterility. So along with using needles, acupuncture needles, there are other ways to stimulate acupuncture points. So one of the ways is acupressure. I'm sure you've heard about acupressure. There's a great book, 4 Paws, 5 Directions, that talks about different acupressure points that you can use for different conditions, hip dysplasia, elbow dysplasia, GI upset, kidney disease, whatever. So that's a great book if you're not familiar with it. Another thing that we'll do is something called moxibustion, where we will apply heat. So the heat, you can put the needles in and then apply heat on the needles with something called moxa. It smells like pot is burning in your clinic. So it can be a little dicey sometimes because clients wonder what you're doing in the back there. But you can also just use the moxibustion by itself without having a needle, using it over an acupuncture point. And we use that for cold conditions. If we're trying to warm a point or warm a meridian, if we have, for instance, those old cold dogs and kidney failure, moxibustion can be really good for helping kind of get the chi flowing and get things moving again. We also sometimes will use friction. And so a lot of times we're turning the needles, jiggling the needles, doing things to stimulate the point. And then sometimes we will also do what we call electroacupuncture, where we take, they actually look like little EKG lead things with alligator clips on them, but you clip those onto your acupuncture needles that you have in certain points. And so sometimes we'll go from, for instance, on the back, bladder 23 to bladder 23. We might go across the back so that we're stimulating both bladder meridians all the way up and down. Or we might apply one electrode at the front of the animal, one electrode at the back of the animal so that we're stimulating in that direction. So we can do it a lot of different ways. And then there's also something called aquapuncture. So aquapuncture is taking a very, very tiny hypodermic needle with a small syringe. And we can use things like homeopathic dilutions, vitamin B12 is very commonly used. And in each acupuncture point, a very small amount of whatever product we're using, and it can just be saline, is injected into the acupuncture point to stimulate it. Some people believe that by doing that acupuncture and injection, because we're leaving the B12 or whatever in that area to stimulate it, that we get a longer lasting effect. It's also thought by doing electroacupuncture that we will also get a longer lasting and maybe a little bit more powerful effect with that as well. Some people do aquapuncture in their practice, some veterinarians, just because it's faster. When we put acupuncture needles in, we usually leave them in place for anywhere from 15 to 30 minutes. When I used to get my acupuncture with my acupuncturist, I think they were left in place for like 20 minutes usually, and usually with electrodes hooked up to them. So in practice with your animals, that can take a lot of time. And it also means that we need your animal to stay still so they're not getting up, walking around, pulling out their needles, chewing on them. So it requires a little bit more manpower. So some veterinarians will opt for acupuncture just because they can hit all the points really fast with a little bleb of the B12 and have the entire acupuncture session done in 5 minutes instead of 30 minutes. So it's just a matter of what your practitioner feels is the most effective for your pet, what your pet will put up with. Some of them will not sit still with needles in for long periods of time. So acupuncture can be very effective. The number of points that are stimulated per session can be extremely variable. Some practitioners use a one needle technique. They decide which is the one most powerful point that is going to help rebalance whatever they are diagnosing. So they may only use one needle. The older and more debilitated the animal is, the less needles are used generally, and the less stimulation is used. For animals that have a strong constitution, we might use more needles to rebalance them. And then again, depending on their personality, a lot of times wood animals will not allow more than 2 or 3 needles to be inserted before they say, yeah, you're done. So we have to do what the animal will put up with. So how does acupuncture affect the body? Acupuncture points are believed to stimulate the central nervous system. We think that when we look microscopically, we see sort of a crossroads where a bunch of very fine nerve endings are coming into that area, as well as blood vessels. So when we stimulate that point, it releases chemicals into the muscles, the spinal cord, and the brain. And the biochemical changes stimulate the body's natural healing abilities and promote physical and emotional well-being. The National Institute of Health has done many studies showing that acupuncture is an effective treatment alone or in combination with conventional therapies for many, many Western medicine diagnoses. So I found it to be extremely beneficial in my practice, and I have done acupuncture on horses, rabbits, cats, dogs, people. So it can be extremely effective. I will tell a story on myself. When I took my very first acupuncture course, the first module, just learning, we were given a box of needles and we were told to practice on ourselves if we had any issues, and then to come back the next day and report, what happened. So I had developed just a lovely headache for the day, and the master point for the head is large intestine 4, which is right about here on your hand. And I said, well, I've got these needles and I've got this headache and I've got a hand. So I'm going to give it a try. So I stuck a needle in, no big deal, except I hit a blood vessel on my way through. And so it bled under the skin, and I ended up with the Mickey Mouse hand. So when I went to class the next day, I said, well, good news, my headache's gone. I had a different problem. It was a little tricky taking notes that day. But so this is how we learn. We practice on ourselves. We practice on our animals. If you have not had acupuncture, I highly recommend it. I love it. It's been really beneficial for me personally, and it's been really beneficial for my animals. My Doberman Blink had Wobbler's disease. He was playing with Hugh's big, giant Masso Harley when we first got them together, and they were playing and they got a little too rough, and I grabbed Blink by the collar and pulled him back. And in so doing, I really bothered his Wobbler's disease, his cervical vertebral instability, and he was paralyzed the next day, and he got acupuncture twice a day for 5 days. And I used anywhere from 45 to 60 needles per treatment with him, treating all of his toes, all the meridians to stimulate nerve flow back through the spinal cord, decrease that inflammation, and get things going. It worked beautifully. At the end of 5 days, he was able to walk and run back his normal self again. So that was just one of the many times when I was able to take something that looked like a tragedy and turn it into, no big deal. It was just kind of a oopsie for 5 days. And for those of you with wobblers, don't ever pull on the collar. Don't put a collar on them. Use a harness. Okay, tomorrow we're going to talk about some other fun TCVM topic. Everybody have a wonderful day.